New psychotropic medications. Presentation content includes review of severe adverse effects, schizophrenia, and major depressive disorder. Severe adverse reactions. Agranulocytosis is a decrease in white blood cell production by bone marrow. It increases patients' risk for infections. The signs and symptoms include fever and infections. Cardiomyopathy is a disease of the heart muscle. It decreases the heart's ability to pump blood. The signs and symptoms are heart palpitations, arrhythmias, fainting, and lightheadedness. Myocarditis is an inflammation of the myocardium, which is the middle layer of the heart wall. It decreases the heart's ability to pump blood. Signs and symptoms include chest pain, arrhythmias, fluid retention, and viral infections. Neuroleptic malignant syndrome, or NMS, is a neurological disorder caused by antipsychotics and/or neuroleptic drugs. Males under the age of 40 are the most common individuals who suffer from NMS. Symptoms are often immediate and can cause death. The signs and symptoms include muscular cramps, muscle rigidity, fever, diaphoresis, which is a sweat shock syndrome, altered mental state, autonomic instability, cognitive changes, delirium, coma, and death. NMS is usually misdiagnosed, and supportive measures are used for treatment. Seizures occur due to abnormal electrical activity in the brain. Not all seizures cause convulsions, and they may last between 30 and 120 seconds. Anything greater than 5 minutes is considered a medical emergency. Serotonin syndrome is due to an increase in serotonin levels in the body. It can be reversed by stopping the medication or by taking medications that block serotonin production. Signs and symptoms include agitation and confusion, seizures and unconsciousness, rapid heart rate or a high blood pressure, high fever, muscle twitching or loss of muscle coordination, diarrhea, headache, or shivering. Tardive dyskinesia results from damage to systems that use or process dopamine. It affects the muscular system in the body, mainly the facial muscles. Signs and symptoms include facial grimacing, finger movements, jaw swinging, repetitive chewing, and tongue thrusting. Schizophrenia. The drugs covered will be ziprasidone or Zeldox, clozapine, apoclozapine, paliperidone, Invega, and lurasidone hydrochloride, Latuda. Ziprasidone or Zeldox was approved in 2001. Oral capsules range from 20 to 80 milligrams, and dosages usually range from 80 to 160 milligrams per day. It is similar to risperidone. It may also be used in the treatment of mania in bipolar disorder. Severe adverse reactions include arrhythmias, seizures, fainting, peeling or blistering of the skin, neuroleptic malignant syndrome, stroke, or tardive dyskinesia. Contraindications for ziprasidone include known allergy or sensitivity, a recent MI, or severe heart failure. Clozapine, or apoclozapine, or Clozaril, was approved in 2002. It is for the management of treatment-resistant schizophrenia. The pregnancy category is B. It is not to exceed 900 milligrams per day. The average dose ranges from 200 to 600 milligrams per day. It selectively binds to dopamine receptors and may interfere with adrenergic, cholinergic, histaminergic, and serotoninergic receptors. It is orally administered. The severe adverse reactions include seizures, cardiomyopathy, myocarditis, pulmonary embolism, cardiac arrest, leukopenia, agranulocytosis, granulocytosis, and respiratory arrest. Contraindications for clozapine include uncontrolled epilepsy, a white blood cell count below 3,500, severe CNS depression, and narrow-angle glaucoma. Nursing considerations. Obtain a baseline white blood cell count and monitor the count weekly for the treatment, as well monitor the count 4 weeks after the therapy ends. Patient teaching. Smoking may decrease the effectiveness of the drug. Inform the patient of the need for weekly blood tests, as well inform the patient to report any flu-like symptoms. Paliperidone, or Invega, or Invega Sustenna, was approved in 2003. It is a pregnancy category C. It is for the treatment of schizophrenia and recurrent symptoms. It is a dopamine and serotonin receptor antagonist. It is orally and intramuscularly administered. The contraindications include hypersensitivity to paliperidone or risperidone. Severe adverse reactions include neuroleptic malignant syndrome, tremors, hyperglycemia, orthostatic hypotension, and seizures. Lurasidone hydrochloride, or Latuda, was approved in 2010. It is for the acute treatment of patients with schizophrenia. It is a dopamine and serotonin receptor antagonist. It is orally administered. The average dose ranges from 40 to 160 milligrams per day. Severe adverse reactions include death in geriatric patients, sexual dysfunction, including a 4-hour or greater erection, seizures, stroke, neuroleptic malignant syndrome, or tardive dyskinesia. Contraindications for lurasidone include a hypersensitivity. Nursing considerations. This drug should be administered with food. Major depressive disorder. The drugs covered will be escitalopram or Cipralex, bupropion, hydrobromide or alpenzin, trazodone hydrochloride or Aleptro, vilazodone hydrochloride or Vibrid. Escitalopram or Cipralex or Lexapro was approved in 2007. It is a selective serotonin reuptake inhibitor. It is also used for the treatment of generalized anxiety disorder. It is in the pregnancy category C. The average dose does not usually exceed 20 milligrams per day. Severe adverse reactions include hallucination, decreased urine output, coma, confusion, increased thirst, or swelling of the face, hands, and ankles. Contraindications of escitalopram include hypersensitivity, taken within 14 days of an MAOI, history of seizures, severe kidney disease, history of mania or hypomania, as well as a history of bipolar disorder. Bupropion hydrobromide or alpenzin was approved in 2008. The action is unknown. It is also used for the treatment of seasonal affective disorder. It is not to exceed a maximum dose of 522 milligrams per day. It is in the pregnancy category C. Severe adverse reactions include suicide, insomnia, and anorexia. Contraindications include taken within 14 days of an MAOI, hypersensitivity to bupropion, epilepsy or seizure disorder, or an eating disorder. Trazodone hydrochloride, or Aleptro, was approved in 2010. The action is unknown. The maximum dose should not exceed 375 milligrams per day. It is in the pregnancy category C. Severe adverse reactions include suicide, serotonin syndrome, mania or elevated mood, hypotension, irregular heart rate, hyponatremia, or sexual dysfunction, which includes a 6-hour or greater erection. Contraindications of trazodone hydrochloride include history of heart attacks, bipolar disorder, kidney disease, or liver disease. Nursing implications. It should not be administered on an empty stomach. It is not to be crushed or chewed. Vilazodone hydrochloride, or Vibrid, was approved in 2011. The recommended dose is 40 milligrams per day, and the starting dose is 10 milligrams per day. Dosages should be titrated up from that. A screen for bipolar disorder is recommended as a treatment with an antidepressant may increase the risk of a manic or mixed episode. Severe adverse reactions include serotonin syndrome, seizures, abnormal bleeding, mania or hypomania, as well as hyponatremia. Contraindications for vilazodone hydrochloride include taken within 14 days of an MAOI, liver disease, kidney disease, bleeding or clotting disorder, bipolar disorder, low sodium, or seizure disorder. Nursing implications. Vilazodone hydrochloride should be administered with food. Patient teaching. Taken in a fasted state would create a diminished blood concentration up to 50% and therefore result in a lessened effect of the medication. Now I want to do a quick review of the pregnancy categories. In pregnancy category A, there have been no fetal abnormalities noted in human babies. In pregnancy category B, there have been no fetal abnormalities noted in animal babies. In pregnancy category C, there have been adverse effects to the fetus in animal babies. In pregnancy category D, the risk to the fetus, the human one, the benefits must outweigh the risk. And in pregnancy category X, there are fetal abnormalities, and the drug should not be taken. Question 1. Myocarditis is A. Decrease in white blood cell production, B. Schizophrenia treatment, C. Inflammation of the myocardium, or D. Abnormal electrical brain activity. The answer is C, inflammation of the myocardium. Treatment for neuroleptic malignant syndrome is A, Zeldox or Ziprasidone, B, supportive measures, D, trazodone hydrochloride or Aleptro, or D, there is no treatment for neuroleptic malignant syndrome. The answer is B, supportive measures. Question 3. Paliperidone or Invega was approved in what year and is the treatment for what? A, schizophrenia 2003, B, schizophrenia 2002, C, major depressive disorder 2011, or D, major depressive disorder 2007. The answer is A, schizophrenia 2003. Question 4. Vilazodone hydrochloride, or Vibrid, was approved in what year and is the treatment for what? A, schizophrenia 2002, B, schizophrenia 2003, C, major depressive disorder 2010, or D, major depressive disorder 2011. The answer is D, major depressive disorder 2011. So that's the end of my presentation, and I hope you enjoyed it.